prior to this, for a long time, I feel personally that we did not have options in between sending the patient for physio and giving medication and total knee replacement. Yeah, we were like, two ends of the stick, so to speak. Right. But the journals and all are getting into it. So I read an interesting article in the Journal of Sports Medicine, and it seems as though PRP, APS, the new form of PRP, it does have good effects, and they're claiming up to 3 years good results.
Oh, okay. So I think one of the reasons why it is a bit difficult for some authorities to have a blanket approval of these kind of technology is that, as you correctly pointed out, there are many versions of what people think are PRP or even APS, and I think APS is a step forward, a plus, a PRP plus, and APS stands for Autologous Protein Solution.
Yeah, so I'm a big fan of APS. I've been using it quite a bit the last 2 years or so, and I must say, touch wood, majority of patients have been happy. I use it in patients who are not candidates for surgery, and I've also been using it judiciously in some patients who've actually had surgery where I felt they needed a little something extra. Yeah, interesting concept. They do an extra spin on the PRP. It seems to sort of distill down even more anti-inflammatory cytokines, and that seems to really help with people with joint pain. Quite exciting. Of course, I think we still need more cases. We still need to evaluate, how our patients go, and it doesn't last forever. Some of the papers quote, as I was saying just now, up to 3 years. I've had 1 or 2 patients who've come back after 1.5 years, saying that they feel they need another one, which I've obliged, and then they've been happy again with the second jab.
The ASCA Orbit consensus says that sometimes the injection can be repeated up to 3 times, a single cycle, and that's probably also one of the reasons why it may be difficult for people to come up with a blanket approval, and that's because each preparation is slightly different. And because each preparation is slightly different, sometimes adding an additional spin may actually improve this effectiveness, but giving repeated shots seems to also help in getting...
So like a booster.
Yes, that's right. It seems to also help in getting the symptomatic relief, and I do use it for patients who have got some inflammatory kind of injuries or some pain in the knee that doesn't really hit the criteria yet for surgery, or for certain people who have got problems with injuries in the knee and they do not want to go for surgery for whatever other reasons. So in your experience, how fast does this injection work?
Usually I tell patients it takes between 2 to 4 weeks to kick in, but of course it's a very variable response. Some people do take a little bit longer, hard to say, but you have to also send the patient for physiotherapy at the same time, get them to modify their activities, return to activity, to things that they like to do. They want to do sporting activities. I think about 3 months. That's what I target for anyhow.
Yes, that's right. Yeah. So I've got a couple of patients who seem to have reacted amazingly well. They tell me that they've got relief of pain within the week, but usually the pain starts to get better from the 2-week mark, and I think the maximum effect is at about a 6-week mark.
Right. Yeah, I think so. Yeah. We've talked about PRP and APS. What if the patient needs surgery? What if you find an ulcer in the cartilage?